Assalamualaikum. My name is Shaina Shilisa and I'm here to present a presentation on examination of Precordium, and this presentation is submitted to Dr. Chaman. So first of all, we have to take consent from our patient. क्या मैं आपका मुआयना कर सकती हूँ? इस मुआयने के लिए मुझे आपको अनकवर करना पड़ेगा, क्या मैं वो कर सकती हूँ? ओके, थैंक यू. So our first step is inspection. As we know, in inspection we just observe our patient. We can't touch our patient. We just see any visible scars or any deformity or any caribatum or anything abnormal in our chest. So move on to our second step. Before second step, it is a palpation, and before palpation we have to warm our hands, and then we have to examine our apex beat. So in the clavicle, medially to the clavicle, you have to count the intercostal spaces. One space, this is the medial side of my clavicle, medial side of my patient, and I am going to count the intercostal spaces 1, 2, 3, 4 and 5. So I can feel here, her apex beat is here. So when we locate our apex beat, then we have to check the corrector. Is it in a tapping position or in a heaving position? So in a tapping position, our apex beat is just tap. Our finger is tap on her skin, and then if it is in a heaving, so if our apex beat is in a heave position, then it is just our finger lifted up, and then we move on with our next step, and this is a right ventricular heave. So in a right ventricular heave, we examine our pulmonary area and our mitral area. First of all, we have to check where is the mitral area present. So as we know, the apex beat locate at the mitral area. So I just locate my apex beat, so I know this is my mitral area. Then I have to check my pulmonary area. So there is my pulmonary area, and I check any thrills or any deformity in this area. My next step in my presentation is auscultation. As we know, we do auscultation with a stethoscope, then we have to use this. And I'm going to examine my 4 areas: mitral area and pulmonary area, aortic area and tricapside area. I'm going to check is there any thrill in this or any deformity. So I examine mitral and pulmonary area before starting my this part, and then I'm going with aortic area or tricapside area. I'm locate my apex beat और mitral area. आप सांस अंदर लें, सांस अंदर लें, सांस अंदर लें और सांस को बाहर निकालें. There is no any thrill present in my. My next step is pulmonary area. सांस अंदर लें, अंदर को लें सांस, सांस बाहर निकालें. Pulmonary area is also normal. There is no any thrill present in this or no any murmur present in this. Then I'm going with my aortic area. So here is my aortic area. सांस अंदर लें, बाहर निकालें. There is no any. My next step is tricapside area. So I have to locate first. So there is my tricapside area. सांस अंदर लें, सांस बाहर निकालें. And then I have to check my axillary point. It is also normal. And now I am going with my epigastric. सांस अंदर लें, सांस बाहर निकालें. I have done with my examination, and now I end with a small description. I have a 7-year-old girl. She lie on bed comfortably, and first of all I do an inspection. There is no any scar marks, no disability or no any deformity on the chest. And on palpation, Her apex beat is on a fifth intercostal space, and it is normal in character, it is in tapping character, and then her parasternal heave is also normal. There is no any thrill or any murmurs in it. Her epigastric pulsations are also normal, and her first heart sound and second heart sound and third heart sound is also normal. So in the last, we have to cover our patient and say thank you to her. Thank you.